Today, I have the privilege of reporting on two pieces of independent research proving acupuncture effective for the treatment of carpal tunnel syndrome. So this type of wrist pain, including shooting nerve electric shocks, local pain, soreness, numbness, even inability to use the hands at times, this is very common due to repetitive syndrome, where there's a repetitive motion syndrome. However, one thing that is very common in Chinese medicine clinics using acupuncture is success. And these pieces of research confirm that. The article we see today was published July 24, 2019, entitled Acupuncture Results for Carpal Tunnel Syndrome. What is somewhat shocking is that a licensed acupuncture with experience in this treatment, that is, that they specialize in the treatment of musculoskeletal pain and working on the median nerve and wrist, an experienced licensed acupuncturist should almost every time achieve a result for carpal tunnel syndrome. And the research bears this out. I can say this from over 25 years of clinical experience, that we almost uniformly have success for the treatment of carpal tunnel syndrome. And why? Because its treatment is particularly well suited to acupuncture because it has to do with the median nerve having a problem with nerve conduction. And that is literally, improving nerve conduction is literally the forte of acupuncture. So let's take a look. Acupuncture relieves carpal tunnel syndrome pain and restores function. Two independent studies reveal the benefits of warm needle acupuncture for carpal tunnel syndrome, that's CTS. Participants in both studies experienced significant improvement in pain levels and wrist function. So this research gets into the details and specifics and nerve conduction tests, things, and also physical tests like the Phelan test, Tenel sign, everything like that, measuring reversal of muscle atrophy, ability to grip, weakness upon movement that's healed, and pain levels. And what we found, of course, is that acupuncture was effective, but it also maps out how it was done. So licensed acupuncturists can peer in and see what acupuncture points were used. Every time, what you're going to see in a study is something on the pericardium channel. What's unique about one of these studies is pericardium 5 and pericardium 7, Da Ling and Zhan Shi, which are located on the medial aspect of the wrist, somewhat near the wrist crease, just a few inches proximal to the wrist crease, were chosen. And the other piece of research was more standard with Neiguan PC6, which is approximately 2 inches. It's actually 2 sun. It's a different type of measurement in Chinese medicine. We measure the body anatomically in sun, not in inches, but they are somewhat equivalent for purposes of explanation. So Neiguan, again, is on the medial aspect of the forearm, 2 inches proximal to the wrist crease, but it is more common than the other points from the other study. And they combine them with Da Ling, which is also more common, which is right on the wrist crease, dead center on the medial aspect of the arm, PC7. So PC6, PC7 in one study with a few extra points, Hegu, large intestine 4, large intestine 5, Yang Shi, Liache is lung 7. And the other study has other details. And it gives you a quick insight after a short amount of treatment, what percentage is considered completely successful. In many ways, I found that the success rates, although high, weren't as high as perhaps they could be. So looking at particularly the second study, and I believe that second study would have been better served using Neiguan PC6. Looking at the first study, I think the results were very impressive and reflective of what's used in an acupuncture clinic. So to take a look at this, all you need to do is go to healthcmi.com, click on news, and click view all news articles, which will appear below, and look for the article entitled Acupuncture Results for Carpal Tunnel Syndrome, and you can take a look. This is important. Now, the surgical fix for this, let's discuss that just for a moment. Okay, that's called a release. And in my career, I have worked on and off with physiatrists doing injection therapy, worked on and off with surgeons, trying to control internal bleeding, relieving pain after surgery, allow for quicker recovery for athletes after surgery, for example, working, let's say, on the ACL of the knee when it's reattached. A great simple treatment of Shion with Shisha really helps get in there and return the knee more quickly. A lot of times when people are professionals, they can return to work more quickly on the court, wherever they are. But with carpal tunnel syndrome, this is a special case. And this is something that we need to focus on, because the release that is done for the forearm. Okay, so imagine two tendons coming up the medial, the ventral, the soft skin of the forearm. Not the back of the forearm, the front of it. And these two tendons meet at the wrist crease, dead center in the forearm. And the release is to cut one of those tendons away, because there's a median nerve between them. And when these tendons and the tissue around them are inflamed, they crimp off the median nerve and prevent movement of the hand, cause tingling, numbness, pain, electric shooting sensations, many things. And by simply cutting away, it's called a release, one of the tendons, the median nerve is not squeezed between them and the symptoms disappear. Now, one might ask oneself, has that compromised the integrity of the forearm in some way? And the answer is yes. Now, again, like I've said, I've worked with surgeons for many years, and there are a lot of great surgeries that save lives, restore motion, replace parts that have been broken. And a lot of surgeons, really, they play the role of heroics. They're the hero of the story and can do seemingly impossible things. But this particular procedure is probably antiquated. It really needs to be just remembered as something that was done in history, but it was kind of going in the wrong direction. Why? Because acupuncture for the treatment of carpal tunnel syndrome without comorbidities is approximately 100% successful. So much so that work hardening occurs. That is, people can literally go back and do more than they did before. I remember a person who did a lot of key punch, an accountant. She was doing bookkeeping. And she came in a cast. Searing, burning pain. Her boss wanted her back desperately. Sent her over to the clinic. The chiropractor said, well, you've got to see the acupuncturist. Sent to me. She said, my boss and I really want to get me back. I play a vital role in a small company. We're up and coming, and I just can't use this arm. Repetitive motion trauma. With that searing, burning pain. So here's a young woman up and coming in her career and is now disabled. Pretty much had that thing turned around in about 5 weeks. I'd say 2-3 times a week for a few weeks, and you do 1 time a week for a few more weeks, and you're in there. If it's still delicate and tender, it's sometimes once a month for 2-3 months after that. That's a standard. It can be more, it can be less. I've seen cases that don't budge for 2-3 months. They're so severe. And then we finally get them better. And that's with at least 2 treatments a week. So I'm not saying it's easy to fix carpal tunnel syndrome with acupuncture. In fact, it's a challenge in many cases. Sometimes it's easy. Yeah, there are some cases like that. But for the most part, it's a challenge. And an acupuncturist is going to use every skill achieved to get that result. But the results are achievable because it is very rare that the median nerve has completely died off before someone gets to you. And that's certainly beyond mere carpal tunnel syndrome, if the nerve is gone. But when we go in and do surgery, when we do the release, when they cut away the tendon, we don't get results typically. In other words, the release may have worked for a few years, and then later, the patient comes to us. In that case, we don't have options. it's the one scenario that we can't fix. So I'm not in favor of that surgery, because if its benefits were to wear off, there is no way for me to get that person back on track. So that's the issue. And I'm trying to be very fair-minded about that. But some surgeries don't belong, because while they may be relatively safe and effective to some degree, they are not the most effective and they are not the safest. So optimal patient outcomes is ultimately the goal of every form of medicine. Achieving the best result for the patient with the least amount of side effects is optimal. So again, these two studies show kind of the straightforward version of how to test for the problem with things like EMG tests, so these nerve conduction studies, etc., before and after to confirm it. How the treatment is done, how the results are gained, what time frame someone should expect it. Here they use warm needle acupuncture, which is interesting. This when they burn a little bit of moxa on the needle. So that's also kind of interesting. So there's a lot to learn in this. Go to healthcmi.com. Take a look at the article entitled Acupuncture Results for Carpal Tunnel Syndrome. Just simply click on News and look for the title. Thank you for listening. www.healthcmi.com.